All right, everyone, I'm going to go ahead and share my screen here with you real quick. And we are going to be doing an audio lecture and PowerPoint on chapter 23, safety. Right. So this starts on page 667 in your book. We'll go ahead and get right into it. So patient safety, just as a disclaimer, is extremely important in healthcare, and it will be extremely important for you to be knowledgeable on that or on this concept during your NCLEX examination, because they test on safety a lot. Okay. So safety is a basic human need, okay? It is second only to survival needs such as oxygen, nutrition, and fluids, okay? By definition, the condition of being safe from undergoing or causing hurt, injury, or loss. That is the Webster's definition of safety, okay? As a nurse, you will be fundamentally concerned with the safety of your clients. You must also be concerned with your own safety and the safety of other care providers as well. Many accidental injuries can be prevented by being aware of hazards and taking reasonable precautions. According to the CDC, accidents and unintentional injuries are the fourth leading cause of death in the United States. An estimated 130,000 people die each year as a result of accidents. Expressed another way, one person dies from an accident every 5 minutes. Poisoning is now listed as the #1 cause of unintentional death, followed by motor vehicle accidents, firearms, falls, drowning, and fires. Okay. There are developmental factors affecting safety. This includes age, okay? For infants and toddlers, we know that they cannot recognize danger, okay? They have a tactile exploration of their environment. They love to touch and feel and have sensory feelings towards their environment, okay? They also completely depend on others for their care. They're totally dependent, okay? Motor vehicle accidents are the leading cause of death for children ages 1 to 3, followed by drowning, okay? Falls, choking, sudden infant death syndrome, or SIDS, and ingesting poisons are other critical safety concerns with kids this age, okay? Kids have the ability to walk and manipulate objects before they have the judgment to recognize the dangers, such as falling, okay? And in addition, infants and toddlers are curious and tend to explore environments by putting objects in their mouth. This is why the incidence of choking is highest between ages 6 months and 3 years. As their mobility continues to improve, toddlers gain more freedom, and their curiosity leads them to explore cupboards, stairs, open windows, swimming pools, and other hazards. When we're talking about preschoolers, motor vehicle injuries continue to be a major cause of accidental death, along with drowning, fires, and poisoning for this age group. However, falls are the primary cause of non-fatal injuries for preschool kids. After age 3, children are a little less prone to falls because their gross and fine motor skills, coordination, and balance have improved significantly. However, the extension of play to the outside environment, such as playgrounds, pools, front yards, and so on, this creates additional safety concerns for these kids. When we're talking about school-age children, so motor vehicle accidents continue to be a leading cause of accidental death in children in this age group. However, the absolute leading cause of non-fatal injury in this age group is falls. School-age children have developed more refined muscle coordination and control, so their decision-making skills have improved. However, because they become more involved in activities outside the home, bone and muscle injuries are very common. Injuries are often related to sports, skateboarding, and bicycle riding. Playground injuries are also common. Most school age kids are ready to try any new skill with or without practice or training. So they're way less fearful than toddlers. And the exposure to wider school and neighborhood environments also increases the risk for injury inflicted by people outside of the home, such as abduction, child abduction, right? Adolescence. So the leading cause of death in adolescence is motor vehicle accidents, followed by homicide. Both of these are frequently associated with drug and alcohol use. So that's a very important factor. Sports and recreational injuries, including diving and drowning accidents, are also common in this age group, especially when drinking and drugs are involved. Peak physical, sensory, and psychomotor abilities give teenagers a feeling of strength and confidence, but they lack the wisdom and judgment of adults. So this combination, along with feelings of being indestructible, which they likely feel, makes them more likely to participate in risk-taking behavior, and in turn makes them more prone to injury. Adults. So poisoning is now the major cause of death and injury in this age group, followed only by motor vehicle accidents. Workplace injury may also be a significant concern. Other injuries to adults are usually related to lifestyle, such as excessive alcohol use, stress, carelessness, abuse, and then decline in strength and stamina, which may contribute to falls and things. For many, work and family responsibilities often leave little time for regular physical activities. This increases the risk of musculoskeletal injury in the quote weekend athlete, where they do lots of activity on the weekend. When they're not used to it, I guess. And thinking about older adults, we want to think about many older adults have intact senses that enable them to continue to enjoy life as they age. Physiological changes do occur. These changes may include reduced muscle strength and joint mobility, slowing of reflexes, decreased ability to respond to multiple stimuli. And sensory losses, like we talked about last in the last PowerPoint that you probably watched about sensory losses in the hygiene chapter. So when you think about sensory losses, you're thinking about no sensation, increased risk for injury, increased risk for pain. Okay, particularly we're thinking hearing and vision, where these put us at risk for injury. Okay, these changes increase the older adult's risk for falls, for burns, car accidents, and other injuries. Falls are the most common cause of accidental death for adults age 50 and older. Individual factors affecting safety. So what in our lives as individuals puts us at risk for safety concerns? So lifestyle, smoking, alcohol use, not wearing a seatbelt, risk-taking activities, things like that. Cognitive awareness. So some people may be confused, or do they have short-term memory loss due to stress, or have they overloaded themselves, that kind of thing? Are they not paying attention while they're driving because their mind is thinking about something else? Sensory perceptual status, so loss of hearing and sight. So that's our first line defenses. So how much more at risk for injury would you be if you couldn't hear? What if you couldn't hear a train whistle in the distance? What if you couldn't see a step and you trip? Things like that. Ability to communicate, so language and hearing barriers. Have they maybe had a stroke? Are they deaf? These put us at risk. What if you can't hear the fire alarm going off and your building's on fire? Mobility status. So how do they walk? Do they have an unsteady gait? Are they able to walk without assistance? Physical and emotional health. So depression, feeling of hopelessness, that can affect our safety. And then awareness of safety measures. So with kids and older adults, are they able to be aware of the risk that is presented in their immediate environment? Safety hazards in the home. So with poisoning, when we're talking about poisoning, so the most poisoning of young children occurs because of improper storage of household chemicals, medicines, cosmetics, vitamins, these kind of things. So it's super important to educate your patients to never leave their kids unattended around prescription drugs or cleaning solutions or poisons, okay? Never leave them unattended. Older children and adolescents may attempt suicide by overdosing with medicines or be poisoned accidentally when experimenting with recreational or prescription drugs. That is a common thing as well. So these are all things that we want to think about. So when we're talking about prevention, we want to talk about cabinet locks, storing poison high, keeping the poison control telephone number available. And just make sure that obviously young children are not left unattended. That should be your first line of defense so that you can catch something if something were to happen. So for adults, most poisonings occur as a result of illegal drug use or misuse, abuse of prescription drugs, especially narcotic medications, so pain medications or tranquilizers or antidepressants, okay? So if there is a poison overdose and we're thinking about treatment options, it most of the time depends on the poison that is ingested. For most poisonings, the most effective intervention is professional administration of activated charcoal, orally or through a gastric tube. However, it's not effective for some things like ethanol or alkali, iron, lithium, things like that. Depending on the situation, other options for medical treatment include gastric lavage, dialysis, which is where they filter out chemical compounds from your kidneys or from your blood, administration of antidotes. Some drugs have antidotes, forced diuresis, which is where they make you pee a lot to get it out. It all just depends on what is ingested. It's important to know that you should never induce vomiting when the ingested material is acidic to the esophagus. Okay, that can be a real problem. So never induce vomiting in that way. Carbon monoxide poison. So carbon monoxide is a colorless, tasteless, odorless, toxic gas. Exposure can cause headaches, weakness, nausea, vomiting. Prolonged exposure leads to things like seizures, dysrhythmias, unconsciousness, brain damage, and it can kill you in a short time. The burning of fuel such as wood, oil, gasoline, natural gas, kerosene can produce dangerous levels of carbon monoxide. It can build up because of a faulty furnace, and it builds up quickly in unventilated garages when a car is running. Other consumer products involved in carbon monoxide related deaths include lawnmowers, gas water heaters, charcoal grills, things like that, gas ranges and ovens. And many of these deaths occur during cold weather among older adults who are seeking other heat sources such as gas ranges and ovens to stay warm. Okay, so signs of a good night out or carbon monoxide poisoning, right? So headaches, nausea, breathlessness, collapse, dizziness, loss of consciousness. So keep those in mind. Scalds and burns, these are other hazards in the home. So these burns can be from hot water, they can be from grease, they can be from steam or a sunburn or cigarette burns. So scalds and burns are the most common cause of burns in children younger than the age of 3. So warming food or formula in the microwave may cause food to become hotter than intended, leading to burns in infants and young children. Sunburns can cause a first or second degree burn, and burns may occur from contact with metal surfaces that lay out in the heat or vinyl seats when cars are parked in the sun as well. Scalding burns, especially on both feet and both hands, and cigarette burns in children and vulnerable adults should always prompt you to assess for abuse. These are called suspicious findings. So scalding burns on both hands or both feet, and cigarette burns in children and vulnerable older adults should prompt you to think about abuse, okay? It's important to know. So when talking about prevention of scalds and burns, so we wanna make sure that we are educating our patients to keep guardrails by the fireplace, turning pot handles. So children can reach those pots up there on the stove and they can pull down boiling hot water on themselves. Care with candles is important. putting on sunscreen on their children, and taking care when warming food in the microwave. My dad, actually, when he was a young infant, he had his home was heated with an electric, or a, I don't even know what it's called, but it's like a gas or an electric like heating element that was just out in the open, not like the central heat that we kind of have these days. And he had actually was an infant and had rolled off the bed, and his face landed on this heating element. And he said he was very young, but his face literally melted off, and he has a giant scar across half of his face because of that. So this is very, very important. Fires. So home fires are a major cause of death and injury. Older adults and children younger than the age of 5 have the greatest risk of fire death. Okay. Fires can be caused by cooking, smoke inhalation, home heating equipment. Cooking fires are the #1 cause of home fires and home fire injury. However, the most fatal home fires occur when people are asleep, and most fire-related deaths occur from smoke inhalation. Okay, so when we're talking about prevention, we want to educate our patients on smoke alarms, making sure that they change the batteries every so often. Take extreme caution with their cigarettes. Know how to use a fire extinguisher. Don't leave candles unattended. Don't go to bed with candles burning. Take safety with holiday lights. Follow the manufacturer's instructions, and take care with electrical cords. It's all good educational material. Falls. So when we're talking about falls, they're most common in patients that are 65 years and older, and can have a variety of causes. Okay. Environmental factors that can contribute to falls include slippery floors and bathtubs, lack of grab bars to use, too low of toilet seats, high beds, things like that. Health issues can also cause an increased risk for falls. So poor vision or hypotension, which means low blood pressure, a history of previous falls, a patient who has multiple episodes of dizziness or pain, frequent alcohol use, cognitive impairment, polypharmacy, which means that the patient is on multiple different kinds of medications, arthritis, any type of balance defect in an age of greater than 80 years old. Those are all going to put you at a higher risk. Prevention for these patients is going to be to encourage non-skid shoes, to tidy clothes, proper lighting in their home, grab bars and rails, making sure that those are available, and having no scatter rugs. So loose rugs that are loose on the floor that may slip when you step on, you always want to advise against that. Okay. Keep the room free from clutter, making sure they have their glasses within reach. Those are important interventions. So firearm injuries. So these gun ownership is a controversial issue, as we know. Some people keep guns in the home for protection and or recreation, like hunting or target shooting. However, guns are a source of unintentional injury and death. Gun safety and security are especially important when there are children in the home or someone with a substance abuse problem. Young children may handle a loaded gun with tragic results. Household access to firearms has been implicated as a risk factor for youth suicide and domestic homicide, as well as unintentional injury. Because of the frequency and severity of unintentional firearm injuries involving children, the American Academy of Pediatrics and other groups have mounted efforts to educate parents about firearm safety. Firearm safety education for parents and children is a super important intervention for these patients and their families. Make sure that they know about proper locked storage and to keep ammunition separate from the gun and keep the gun unloaded. Suffocation. So suffocation by smothering is the leading cause of death for infants younger than 1 year old. It can be caused also by drowning and choking on a foreign object or inhaling gas or smoke. Food items are especially problematic, including hot dogs, raw vegetables, popcorn, hard candies, especially circular shaped. Nuts and grapes those are the most common culprits that are responsible for most non-fatal choking incidents in children. Children can also choke on non-food items such as latex balloons and plastic bags. These cause the majority of suffocation deaths in young children. Suffocation in infants is often related to bed or crib hazards, such as excess bedding or pillows, or toys hung from ribbons on the inside of the infant's crib. Super important to educate parents not to put anything in the bed with their infant. No blanket, no pillow, don't lay your baby on their belly to sleep. Baby's only on the back. This is very important education that could save somebody's life. And then infants can also become entangled in cords. So cords from window blinds or the ribbon or string used to hang a pacifier around the infant's neck. Those can become deadly. So when educating for prevention, we're going to teach the parents to watch for small removable parts and toys. We're going to teach them to cut food into tiny pieces that are not circles, that are not the exact size of your windpipe. Pay close attention to mobiles, strings, cords, and plastic bags. Apply a barrier with a lock if possible to the pool, and teach parents that they need to know the Heimlich maneuver so that they can jump in and save their baby or their child in an emergency situation. Take-home toxins. So these are hazardous substances transported from the workplace to the home. The National Institute of Occupational Safety and Health reports that pathogenic microorganisms such as asbestos, lead, mercury, arsenic, pesticides, dozens of other agents also cause significant morbidity and mortality in workers' homes. These toxins are most likely to be transported to workers' homes on the workers themselves, on their clothing, or on objects brought home from the workplace. In the home, contamination occurs via a variety of sources. Okay, direct skin to skin contact or dust particles, or even vectors such as ticks that may transport Lyme disease. So just be aware. We need to teach our patients to be aware of workplace preventative measures. We need to tell them to remove their work clothing before they get home, shower if appropriate, and use gloves if necessary. We're going to test your knowledge. So which of the following instructions is most important for the nurse to include when teaching a mother of a 3-year-old about protecting her child against accidental poisoning? A, store the medications in a cabinet out of reach for the child. B, purchase medications in child-resistant containers. C, take medications in front of the child and explain that they are only for adults. And D, never leave a child unattended around medications or cleaning solutions. So you can pause here to think, but I'm going to go ahead and move on. The correct answer is D. A child should never be left unattended around medication or cleaning solutions. It is the answer that would prevent an accidental poisoning most. So when you go back and break down this question, another NCLEX style question that we love so much, all of these things would likely be great to educate our children to not take these medications or to keep them out of harm's way. However, if we are never leaving them unattended, we don't need any of these other interventions because we will be watching them the entire time. So you just have to really use your critical thinking when breaking these questions down. All right, one more. A child has had hiccups for 2 hours. Is this a sign of suspected ingestion of poison? A, yes, B, no. The answer is B, no. Hiccups are not a sign of suspected ingestion of poison, okay? All right, so moving on to safety hazards in the community. So motor vehicle injuries. These are the second leading cause of accidental death in the US. Adults and children older than 1 year of age. They account for about 37% of all accidental deaths. Failure to use seatbelts and proper child car seats continues to be the major contributing factor to these deaths. Severe injuries and death also occur from airbag deployment when young children are improperly placed in the front passenger seat. Many of these fatal motor vehicle accidents during adolescence involve abuse of alcohol or other substances. Also driver distraction, which is a big thing in our community right now. So talking and texting with cell phones is a contributor to motor vehicle accidents for adolescents, especially, and also adults. The risk of being injured or killed in a car crash increases for older drivers. Every day, on average, 500 people over the age of 65 are injured in an automobile accident. Prevention that we can teach our patients, we want them to avoid distractions in the car. So cell phones, loud music. We want to use a designated driver if we know we're going to be drinking alcohol that day. Use seat belts, proper age-dependent restraints for children, a 5-point harness, keeping them in a car seat until they're 8 or they reach the weight limit. These are super important things. Other safety hazards in the community. So foodborne pathogens. So food poisoning is what we're thinking of. It's a non-specific term that describes illness caused by ingesting bacteria in their food. Improper food storage and preparation are a major cause of this. Raw foods are commonly associated with foodborne illness. For example, raw meat, raw poultry, raw eggs, raw shellfish, unpasteurized milk, that kind of thing. Poisonous chemicals in the environment, such as mercury, arsenic, zinc, and potassium chlorate, may also contaminate your food. Education to these patients is very important intervention for preventing food poisoning. Proper storage, proper cleaning and cooking of foods, and then clean cooking surfaces. Make sure that we disinfect them appropriately. Vector-borne pathogens is another community hazard. So remember vector, when we learned in our infection control chapter, these are organisms that transmit pathogenic bacteria and viruses from one host to another. So mosquitoes, for instance, rodents also, rats, birds, other animals, and things like that. So prevention, we want to drain standing water. Remember, we've talked about that in a couple of these PowerPoints, but standing water breeds bacteria. You should always, always, always think that, okay? So we want to drain standing water. We want to use insect repellents, protect the skin contact with insects, wipe out any breeding areas, that kind of thing. And then waterborne pathogens. So people who live in substandard housing may not have safe drinking water. Hot water, they might not have hot water for washing or adequate methods of waste disposal either. So people in rural areas often depend on private wells, which may not be adequately maintained or tested for pathogens, like E. coli, for instance. So we want to always teach our patients to test the wells for pathogens, provide adequate running, and to provide adequate running and hot water as well. Pollution, this is another community hazard. So motor vehicle emissions are a major cause of outdoor air pollution in the United States. Other toxic air pollutants can include asbestos, metals such as mercury, like we talked a little bit about, and then emissions from factories and power plants in the area. Teaching prevention, so proper disposal of recycling and solid waste, environmentally safe products. We want to make sure that we're teaching them what to use if they can't use what they're using already. Encourage carpooling to prevent exhaust pollution and public transportation. Also preventing passive exposure to tobacco smoke, because that can be associated with respiratory disease and cancer as well. And then weather, we want to talk about being aware of weather events. Okay, so weather conditions play a major role in outdoor recreation. It's important for professionals, participants, and outdoor recreation providers to understand severe weather conditions. Okay, we always want to make sure that that these patients are aware for prevention to have a weather radio receiver unit with a warning alarm tone and a battery backup to receive the weather bulletins. Check the weather forecast before leaving for extended periods outdoors. And if severe weather threatens, check on the people who are elderly, very young, or mentally or physically disabled. Develop a disaster plan and identify a safe place to take shelter. So safety hazards in the healthcare facility. These are really the important things that you need to focus on when it comes to being a nurse. So when we talk about never events, so a never event is also known as a serious reportable event. These are healthcare acquired complications. So they acquire in a healthcare facility, right? That can cause serious injury or death to a patient and should never, ever happen in a hospital. On the list of never events, it's been expanded over time to events that are clearly identifiable and measurable, very serious, and usually prevented. Okay. And so here you can kind of see some examples on this page of some never events here. So primary and ambulatory care, this is talking about like a doctor's office or a wound center that you go to for an appointment and then you come home. And then on the right side, you'll see hospital care. So these are your never events. So never event, wrong surgery site, that should never happen. Pressure injuries, that should never happen. Venous thromboembolism, that should never happen. That is the kind of thing. And then right in the middle, adverse drug events, that means it's something that applies to both ambulatory care and hospital care. Okay, falls are even considered a never event. So when there is a never event, then there's something called a root cause analysis, or an RCA. This tries to solve problems by identifying and correcting the underlying cause of events as opposed to simply addressing their symptoms. So the goal is to decrease the likelihood that the problem will ever reoccur, because we kind of get the problem right from the source, if that makes sense. A root cause is typically a finding related not to individual error, but to a process or a system that has potential for redesign to reduce risk. So a root cause finding is usually used for the purpose of redesigning a process or a system, okay? It asks these questions: what happened? Why did it happen? And what can be done to prevent it from happening again, okay? When we talk about a culture of safety, a positive nursing unit culture helps improve patient outcomes. Culture is a way of thinking, behaving, or working in a place or organization. So in a culture of safety, nurses practice in an environment where all staff work together to create a safe unit, disclose errors without fear, and address any safety concerns. Key components include team empowerment, open and honest lines of communication, transparency between team members, and accountability. A high reliability organization, or HRO, is a commitment to patient safety and quality healthcare, and is based on maintaining high organizational standards that we should all shoot for. So going into safety hazards in a healthcare facility. So falls are by far the most common incident reported in hospitals and long-term care facilities. The most important, and I would put a star by this, the most important thing to do is to identify risk factors for a patient falling and which patients are at risk for falling, okay? If at the very beginning of our patient's admission, we realize that they are at risk for falls, we will do what we can to prevent a fall, okay? So assessing and identifying who's at risk for a fall is the most important intervention. Risk factors for falls include poor vision, cognitive impairment, difficulty walking or balance, hypotension or low blood pressure, weakness, drowsiness from medications, that kind of thing. Other things that can contribute to falls in a healthcare facility include alarm fatigue. So how many of you guys work in a healthcare facility and you hear call lights in your brain, or you have patients who are on like a pressure alarm where when they stand up, a big alarm goes off? And alarm fatigue just means maybe the same patient keeps doing it every 5 minutes and you know they haven't fell yet. And so you take just a little bit longer to get to the room to get them because you have alarm fatigue. Okay, so that's failure to recognize and respond to actionable clinical alarms in a timely manner. Missed alarms can cause harm, most commonly when the medical device does not detect the condition or the alarm is not communicated to a medical provider, okay? Also, equipment-related accidents. So these usually occur when equipment malfunctions or is used improperly. For example, when bed alarms fail to work or are set up incorrectly, or when suction devices or infusion pumps are not working properly, or when oxygen is transported incorrectly, or wheelchairs and beds are not locked during transfer activities. Those are all things that can contribute to falls. Fires are electrical hazards. So a fire in a healthcare agency is more often related to anesthesia or improperly grounded or malfunctioning electrical equipment. Most healthcare agencies have policies for preventing electrical hazards, but patients and visitors still do break the rules sometimes. So smoking cannot be discounted as a hazard in a hospital just because it's not allowed. Sometimes you will find people smoking in the bathroom, and that's a big deal. And then restraints. So restraints are devices or methods used for the purpose of restraining a patient's freedom of movement or access to his body with or without his permission. The most obvious form of a restraint is the use of physical force by another person, but a restraint may also be a mechanical device or a material such as like a vest, or a side rail can even be considered a restraint. A chemical restraint is given to control disruptive behavior. So this would be a sedative, like a medication, a sedative or a psychotropic agent. Those can be considered restraints as well. We never, ever, 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 ever restrain for convenience purpose, ever. Okay, restraints are a big deal, and we'll get a little bit more into that at the end of this chapter. And then mercury poisoning. Mercury is a heavy, odorless, silver white liquid metal. It is toxic in both acute, so short-term, and chronic long-term exposure. It can be inhaled, ingested, and absorbed through the skin. Products containing mercury, including thermometers, thermostats, batteries, and blood pressure devices, they're not as common anymore, but they do still exist. So we need to know about the risk there. So test your knowledge. When implementing the use of restraints on a hospitalized client, the nurse should A, restrain all confused clients so that they do not sustain a fall injury. B, tie the restraint to the bottom of the side rail so the client cannot reach it. C, ensure the primary care provider renews the order for the restraints once every 24 hours. And D, release the restraints and provide skin care at least once every shift. So you can go ahead and pause here, but I'm going to move on. The answer here is answer C. So this statement meets the most current guidelines for providers' orders related to the use of restraints. So restraints require a lot of work. We always, always, always use the least restrictive measures first, okay? Restraints are an absolute last resort. A doctor must order a restraint order every 24 hours. There is no standing order. You cannot put restraints on without receiving an order every 24 hours. We must assess the restraints and document our assessment every 30 minutes while they have it on. Neurovascular checks and skin checks are mandatory to make sure that the restraints are not cutting off circulation and blood supply to the extremity. Remove restraints every 2 hours for eating, toileting, and skincare. Those are the rules with restraints, and we'll go over them a little bit more, and you'll learn them in lab as well, but they're a big, big deal. So I suggest that you review any information in your book about restraints because it's important for you to know. So safety hazards for healthcare workers. So now we're switching from focus on the patient to focus on the healthcare worker. So back injuries. The American Nurses Association reports that 52% of nurses report chronic back pain, likely because many nursing tasks require bending and twisting of the torso, activities that can cause injury when the nurse does not use correct body mechanics. So correct body mechanics is so important. Bending at the knees and not the waist, making sure that you have help, raising the bed to the appropriate height, things like that will make a huge difference. Among the most stressful activities are transferring patients to and from a wheelchair, from the toilet to a chair, weighing patients, lifting them in bed, repositioning them, things like that, okay? So we need to make sure that we're using proper body mechanics. Needle stick injuries. So healthcare workers, mostly nurses and housekeeping staff, suffer up to 1 million injuries per year from needles and other sharps, putting them at risk for infectious diseases such as hepatitis B and AIDS. It is very important that when we get to our injections chapter, you guys will learn the proper handling of sharps, but anything sharp needs to go in the sharps. Anything contaminated with blood that is a needle needs to go into the sharps. We always need to activate our safety and never recap our needles. That's very important. Radiation injury. So this is the process of emitting radiant energy in the form of waves or particles. So like an X-ray or a CT. Patients are deliberately exposed to radiation during these diagnostic tests and certain medical treatments, but healthcare workers who care for these patients are unavoidably exposed to small doses of radiation. And those can all cause us harm over the long term. Violence. Hospital security may not be able to sufficiently protect you from injury if violence breaks out among patients, visitors, and/or staff. Sometimes, unfortunately, in this field, we are even the punching bag at times. And it's just important to know when to call for help and know how to try to de-escalate the situation. But that is a hazard for us. So prevention, use proper body mechanics, make sure there's sharps awareness, know proper disposal and where your sharps containers are, never recap a needle. Radiation precautions as noted in your hospital policy, and environmental awareness of personal safety. Okay, let's test your knowledge. Hopefully you didn't just see my answer. Clicked ahead too fast. How would you, as the nurse, support a culture of safety? Select all that apply. A, complete incident reports when appropriate. B, complete incident reports for a near miss. C, communicate product concerns to an immediate supervisor. And D, identify a person responsible for an incident. Remember that a key component of components of a culture of safety include team empowerment. So every individual has the opportunity to be heard and feel important. Communication, open, honest lines of communication are there. Transparency, so team members are unified in their efforts to eliminate rumors and operate with facts. And then accountability, staff claiming ownership for human error and are willing to disclose the error to prevent future errors. The correct answer is all of them. So all of these are going to support a culture of safety. Okay. When it talks here about a near miss, by the way, if you have a patient that you're walking down the hallway and they slip and they almost fall, that's called a near miss. And that should still be investigated as a fall because that can prevent somebody else from having a fall. So performing an incident report for a near miss is an important intervention. So when we're talking about going through our nursing process, we're going to start with assessment like we always do. So it's important to assess the client's immediate environment. First, it's important to assess our patient as a fall risk. So we're going to determine, are they a risk for falls? That's an important first step. Then we're going to assess their environment. We're going to assess their developmental stage, their individual risk factors, okay? We're going to look at their clinical environment. Is their bed in the lowest position? Are their side rails up, especially if we're turning the patient? Remember, when we talked in our hygiene chapter, if you are doing something on one side of the bed and you've lowered the side rail, you better make sure that you put that side rail up before you leave that side of the bed. That is a super important intervention. It's a safety concern. We're going to assess their home environment through the use of a checklist or some safety assessment scale, depending on your facility. And then we're going to assess for the risk of violence. Talking about nursing diagnoses. So what are some examples of nursing diagnoses related to safety? So some of the NANDA approved nursing diagnoses related to safety are going to be hyperthermia, hypothermia, risk for aspiration, risk for falls, risk for injury, risk for poisoning, risk for suffocation, and risk for physical trauma. So it just depends what applies to your patient, but there are safety nursing diagnoses out there and available. Then the nursing outcomes and standardized outcomes depend on the nursing diagnoses that you choose and what your patient is going through. So when we're planning interventions and implementation, so remember, when we get to our interventions, we're saying, you are the nurse. What are you going to do about it, right? So general safety interventions, okay? specific nursing activities are designed to monitor and manipulate the physical environment to promote safety. These general activities provide an overview in your role of safe nursing care. Okay, so assess. We're going to assess and continually monitor the safety needs of our patients based on their level of physical and cognitive function and their past history of behavior. That's our assessment. We're going to provide client education to foster informed decisions so that we can promote their involvement in their own care and facilitate their post-discharge health. We need to know that they know what to do when they get home. We're going to evaluate and use techniques and processes to avoid nursing errors in the delivery of our care. We're going to remove hazards from the environment and modify the environment to minimize hazards and risk. We're going to use technology to deliver safe and effective care. We're going to establish mutual goals with our clients and teach them about specific safety measures. And if an accident or injury occurs in the healthcare setting, we are going to file an incident report. That is super important to know. That is what you're going to do about it. And then we're going to urge our patients to be active members of the healthcare team. The following specific interventions can address particular hazards in home care. So all of these, if these are home nursing diagnoses that would work as interventions that would work towards getting a patient back home and addressing the safety concerns that they may have there. So preventing poisoning all the way down to preventing take-home toxins, preventing drowning, all of that. Teaching safety self-care. So this is on page 687. So in addition to teaching home safety to clients, you should also promote safety self-care related to particular hazards in the community and the environment. So when we're talking about motor vehicle safety, we're going to teach them not to drink and drive. We're going to teach them not to drive hands-free. We're going to teach them about car seat safety. For food safety, we're going to teach them the 4 C's of food safety: clean, cook, combat cross-contamination, and chill. Okay. Fighting vector-borne pathogens. We're going to teach about bug spray and rodent control. We're going to teach about air pollution, noise pollution, and hazardous pollution. We're going to teach about making a disaster plan with their family for hazardous weather. And then promoting safety in the actual healthcare facility. So if you would view on page 691, box 23-3, these interventions are going to help you prevent common accidents in healthcare settings. So you'll see in box 23.3, preventing falls. It's going to tell you all about that. And that's probably very important for you to review. We're going to teach them about responding to fires. We're going to teach them RACE, okay? We're going to teach them what the RACE is when responding to a fire. So first thing we're going to do is rescue our patient, get our patient out of there. Where are we going to take our patient? Somewhere safe where there's no fire. That's step 1 for the R. The A is activate. We're going to activate the alarm so that everybody knows. We're going to activate the alarm. The C is contain. We're going to contain the fire somehow. Shut the door to where the fire is or something. All right. And then E is going to stand for extinguish. We're going to get the fire extinguisher and we're going to extinguish the fire. Okay. And then lastly, when we talk about restraints, we want to try to prevent the need for restraints. We talked about how big of a deal it is to put restraints on a patient. Remember, restraints are the last resort. So we always try to provide the least restrictive measures first. So this means making sure that we provide consistency in care with no surprises. We review their meds with them. We tell them what we're doing before we do it. We're going to relieve their anxiety by orienting them to the situation. We maybe could try a one-on-one care, get them a sitter, a bedside sitter if possible. We're going to improve our communication. We're going to modify the environment as needed, do hourly rounding, that kind of thing. We're going to make sure that we keep our environment safe. We're going to learn how to use all of our equipment safe. We're going to tag it if it's not right. If an IV pump is not working correctly and we realize that, we're not just going to take that IV pump, put it right back in the storeroom and go get another one. We're going to tag it. We're going to put a tag on it that says this isn't working. we're going to give it to somebody who can fix it. And that is keeping our patients safe, and that's keeping our equipment safe. We're going to reduce alarm fatigue. Okay. We're going to make sure that we try to keep on top of this, no matter how annoying it may be. Okay. And then just a little bit on delegation. So delegation, always super important in nursing, okay? And lots of questions come out of delegation on your NCLEX, so it's important for you to know the rules. So one safety activity you may delegate is applying restraints. You must first be sure that your nursing assisted personnel is competent to perform this skill. That means that you must make sure that they know how to apply restraints. They're allowed to apply them, but you need to make sure they know how. Okay. Although you may delegate the application of the restraints, you cannot delegate the assessment of the patient's status, nor the evaluation of her response to the restraints. Okay. They can put the restraint on. They cannot do your skin checks. They cannot do your neurovascular checks. They cannot evaluate whether or not the restraint is effective. They're not allowed to assess, period. Your assistants are never allowed to assess. Okay. So you can assign to your assistant to remove and reapply restraints, to provide skin care, and to allow supervised movement. And observe for excoriation around the location and report it to you, but you must assess it yourself. Right? So you should be sure that your assisted personnel is aware of and follows the safety measures and institutional policies and procedures. Okay. Remember, we only delegate simple tasks within our assistant's scope. Give them the most stable patients. You cannot delegate an assessment to an unlicensed assisted personnel. That's important to know. Okay. That concludes this chapter on safety.